So if your little points that I'm talking about, your age, the tear size, the length of time it's been torn, the quality of the muscle aren't adding up to a good probability that we'll be able to fix the tear, then we often talk to the patients if they're in an age range where a reverse shoulder replacement is much more predictable. So that age is also coming down. We used to be 70 years old. We'd say, we probably should wait until someone turns that to 70 before using this replacement. But there's ongoing research and evidence that people as young as 60 do very well with those. And so if I get someone who's in their mid-60s with a bad-looking tear, we often will talk about a reverse replacement because it's much more predictable. You only have to be immobilized for a short period of time, 2 weeks versus 6 or 8 weeks. And usually at 6 months, people with reverse replacements are off and going and they're back to life. And people with bad cuffs that are very difficult to repair, I'd say 50% of them are back in the office with their re-tear, and the other half are still struggling to get back to their normal behavior and their normal activities. So it's always a discussion that generates a lot of time and education for the patients just to make sure that they know what it is they're getting into, and we allow them to kind of pick the surgery that they think they're willing to accept some of the risks and the benefits with, because each one has its own little set of problems that we have to deal with.